Hi everyone, it's Dr. Danielle Cooper, Dallas plastic surgeon. So I do get a concern that comes up with my patients from time to time regarding scars. So I will occasionally have the patient that comes in and says, oh, I just want to have liposuction. I don't want a tummy tuck, when what they actually do need is a tummy tuck. But the reasoning for it is because they're afraid of the scar. So I wanted to discuss what to expect from surgical scars and hopefully put to rest some of the fears that you guys might have in regards to having scars after surgery. So there's no surgical procedure that can be done that addresses tissue that's deeper than just the surface of the skin that does not leave some type of scar. So even liposuction, which just goes in through a tiny little 1 centimeter incision, still has a scar. It's just that we do things to try to give you the best scar possible. So with your plastic surgeon, they're going to discuss how the placement of their scars. Ideally, we try to place scars in places that are easily hidden or well camouflaged, so that it's something that is not noticeable at first glance. Maybe somebody, if they're looking up close and really looking for it, might notice it. But in general, if somebody's looking at you from far away, they're not going to notice your scar. Now, it takes about a year for your scar to mature after surgery. So initially, it will look like a nice, clean surgical scar. Post-op day 0, post-op day 1. You're like, oh my gosh, it's so nice and clean, and it's so thin. But the scar changes over time. So initially, it will start off looking nice and thin, but as it heals, scar tissue is put down, and that can cause your incision to thicken up a little bit. Usually at about the 4 to 6 week mark, depending on how you're healing, we will have you start doing scar massage to help soften up and break up some of that scar tissue to get that scar back flat. Other things that we do to try to optimize the scar is to decrease tension on the scar. So there are certain techniques that your surgeon might use. For example, in a tummy tuck, the surgeon might use progressive tension sutures to offload the tension from the incision to give you the best scar possible. We will also have certain activity restrictions. We'll also put you in supportive garments that help to support the incisions while they're healing, and to, again, take tension off of those incisions, because tension causes a scar to widen. So the goal is, after surgery, is to support the tissues and take as much tension off the incision as possible. Now, as far as how a scar matures, so like I said, initially it'll start forming some scar tissue. The scar might thicken up a little bit, and then over time it will soften, particularly when you start doing scar massage. We do recommend that you use different type of scar creams or oils, like vitamin E oil, sometimes silicone gel or silicone sheets on your incisions can help to improve the appearance of your scar. We do recommend avoidance of UV exposure, because in that first year, any exposure to UV rays can cause the scar to hold on to some pigments that we don't want to have. So using sunscreen, using UV protective clothing, or trying to avoid the sun altogether will be your best options, particularly in that first year. Now, there are some people that just genetically at baseline just form poor scars. For example, somebody that has a history of keloiding. So sometimes there's not really ways to avoid it, particularly if there's some genetic component to it. But for example, with a keloid, what we can do is, if we notice that a scar is starting to keloid, we can inject some steroids into it to try to get it to soften up. There are other techniques that you can use to try to address either pigmentation issues or texture issues with the scar, including some skin lightening creams, laser treatments, radiofrequency modalities that can help to improve the appearance and texture of a scar. So there are ways that and tools that we have that we can improve a scar if it's not turning out the way we want it to. But for the most part, people tend to heal very well. And like I said, we place the incisions in areas that are easy to hide and not as noticeable. And for the most part, people have very fine, very barely noticeable scars, but there is always going to be a scar there. So just something to keep in mind, but I hope that helps to decrease some of the concerns that people might have about scars. But if you have any questions, please leave them in the comments below.